Hi, my name is Dr. Charlie Hammerton, and I'm the Clinical Learning and Development Lead at Zava, Europe's largest digital healthcare company. I've been working as a doctor and educator in digital healthcare for a little over 4 years, and with the huge shift change that the COVID-19 pandemic has brought, I've been asked by the Royal College of Physicians to record this short video to support and empower those of you who are newly incorporating remote digital care into practice. Before I start though, on behalf of myself, Zava and the RCP, I wanted to thank everyone who is working so hard to care for people through this devastating pandemic. Most importantly, take care, social distance, wash your hands and stay safe. Hopefully, incorporating remote digital care into your practice will allow you to do that. We know that digital healthcare, when used in the right way, allows the right people to be seen by the right clinicians at the right time, and has huge potential benefits to patients and healthcare professionals alike. With the current COVID-19 outbreak, there's the enormous benefit preventing viral transmission. And beyond that, it has potential benefits in accessibility, convenience, efficiency, and patient empowerment and satisfaction, just to name a few. In this video, I'll be talking you through what digital healthcare is, when it may be appropriate to consider remote care and the types of remote care you could offer, some tips on setup and logistics, some of the key differences in remote consulting, and suggestions about learning and accessing support in a remote setting. So what is digital healthcare? The World Health Organization defines 4 key elements in digital healthcare, which are around providing clinical support, overcoming geographical barriers, involving various types of tech, and improving health outcomes. By this definition, digital healthcare is remote. So if I refer to remote healthcare, please assume I mean healthcare that is both digital and remote. At the moment, digital healthcare largely falls into one of 4 types: live video consultations, live chat consultations, so either instant messaging or telephone, questionnaire-based advice services, which tend to be asynchronous and may include images, and online doctor-pharmacy partnerships. So when is it appropriate to consider remote care? The GMC has long-standing remote prescribing guidance, which you can see on the slide. It goes without saying that a patient with straightforward needs who you already know and you don't need to examine is an obvious candidate. In the current climate, the GMC has recognised we need to work differently to mitigate the risk of transmission. We should be thinking digital first. However, there will be patients for whom a face-to-face consultation is still the overall safest option, and the guidance can help you identify these. For example, patients who lack capacity, require intimate examination, or are particularly complex or high risk are unlikely to be appropriate. Keep in mind that some examinations are possible remotely. For example, both static images and video allow inspection, and I've linked some videos with some tips on clinical science at the end. I'd recommend spending some time with your colleagues to plan and get some consensus, particularly around the kinds of appointments, the technology, and processes for concerns and support. There's some very helpful guidance on this too, which, although aimed at primary care, does contain a lot of transferable principles. Deciding on the type of remote care. Once you have your patient groups in mind, it's important to consider how you can deliver care, factoring in patient, clinical, and logistical aspects of what's available. Video is the most similar to face-to-face care and is good for limited clinical examination or to discuss more complex issues. It's also something patients may be familiar with already and may prefer, particularly if they're anxious about COVID-19. But it's important to consider, is it always needed? Telephone consultations or even live chat still allow you to take a detailed history or have an in-depth conversation in real time. Whilst you may be missing some non-verbal cues, phone consultations are likely to be simpler, quicker, and easier. So where you don't need video, which due to COVID-19 is currently in high demand and could therefore be subject to more technical issues, keep it simple and cool. For simpler interactions, don't forget about written consultations too, for example by email or using questionnaires, which can be very efficient. For example, you could create template messages for common scenarios, such as simple test results, and while some time and thought could be needed to set this up, in the longer term it can make things a lot easier. Logistics and setup. For those of you who may be new to digital healthcare, whatever your context and application you're using, test it. And if you can, ask your patients to test it ahead of the consultation too. It may seem obvious, but checking in advance you have a secure internet connection, testing out what the system can do, and knowing how and where to access records and document will allow you to focus on helping your patients. And just in case anything fails, have a backup. Make sure you've got an alternative contact for the patient and know where you can go for technical support. If you're using video, there are some extra considerations around your environment too. For example, the setup of the room, the camera, and the light. I've also included some links to further tips and guidance around this at the end. So what are the key differences to be aware of? For clinicians, the hardest and most complex aspects of caring for patients in the current context with COVID-19 will be nothing to do with going digital. But there are some nuances to digital healthcare, and I hope having some insight into them will make the digital transition a little easier. Firstly, patient identity. Checking who the patient is and introducing yourself is standard practice, and this ideally should include some verification, such as age or date of birth and address. It's not a situation you're likely to encounter face-to-face, but remotely, if you heard what sounded like a voice with a different gender or a significantly different age to a medical record, how could you approach this? There's a lot of possible reasons this could happen, but remember you can always pause the consultation and you're still part of the same team who are there to help navigate tricky situations. Secondly, safeguarding. So that's making sure you and your patient are safe and there's no other influences without the patient's consent. Keep in mind that remotely, it may not be possible to pick up on non-verbal signs. Unless you ask, you may not know where the patient is in case you need to send help. So before you get started, check the patient's location and contact details, ask the patient if they're alone, and to introduce anyone else who may be present or has access to their messages. And check your local safeguarding procedures to see if you need to make any adaptations for remote care. Moving on to capacity and consent. It's unlikely to be appropriate to offer remote consultations to someone who you know lacks capacity. But we should always assume a person has capacity, and I'd recommend you think through what you would do if you had concerns mid-consultation. Something like this is difficult to judge, and it's always okay to call a timeout, discuss with colleagues, and consider a face-to-face appointment. With informed consent, again, the principles remain the same, and NHSX advised that by joining a digital consultation, consent is implied. Even so, it's good practice to take and record verbal consent at the beginning, particularly if you're recording the session. And if you're giving advice via message or email, get consent for this too. Which brings me to confidentiality. Fundamentally, it's the same as a face-to consultation, just virtual. In terms of information we're sharing with colleagues, the NHS has acknowledged that you will need to work in different ways, and the focus should be on what information you share and who you share it with, rather than how you share it. Again, I've included some links which cover this at the end too. Lastly, but certainly not least, is drawing your attention to differences in communication, which may be more challenging. It may be harder to pick up on both verbal and non-verbal cues. An unfortunate typo or a badly timed loss of audio could completely change the meaning. This may make it feel more difficult to explore sensitive issues, but in our experience, some patients prefer digital consultations and actually open up more, particularly with written messages. So keep it patient-centric and follow their lead. Bear in mind that written communication, whilst it relies most heavily on the words themselves, also allows more time to consider and reflect on your message. But however you're digitally communicating, you may not get any instant patient feedback, so be extra conscious of how what you say could be received. With this in mind, here's some quick tips. Keep things as straightforward and simple as possible, and make sure you explain medical terms in plain language. Try to match the patient's language and what you perceive to be their knowledge level. Use your resources, particularly if you're using a computer. You can draw on and signpost patients to trusted sites. Take care to summarise and clarify anything that may have been missed. And if it's a written message, use different formatting to highlight key points and add high-quality medical links to add depth of information, build trust, and justify your advice. Learning and support in a remote setting. COVID-19 will challenge us all in different ways, and one of those ways may be working remotely, but this should not mean working alone. More than ever, working as a team is essential, and what we found is a huge amount of learning does take place situated in digital practice. There's a few simple things you can do to support each other and facilitate shared learning. Firstly, share patients and discuss cases. The technology is there, so there's no reason you can't discuss with your colleagues or hold team meetings remotely. Try to maximise the value of this time too. Set objectives, and if it's a complex case, make some quick notes to formalise the risks and mitigations you want to discuss. Secondly, arrange regular catch-ups with your colleagues. A quick daily team chat provides an opportunity to ask advice, get support, and plan your team's activities, as well as just being the simple act of seeing how each other are. Thirdly, use your resources. There's loads of trusted and transferable guidance to help you online, and the RCP have and are creating more resources to support you. As a starting point, I hope the references at the end are useful, and if you can, create shared templates or FAQs amongst yourself to save each other time and embed learning. Before I close, I want to acknowledge that in digital healthcare there is the potential for feeling somewhat isolated, particularly with the current pressures of COVID-19. So if it's something you struggle with, talk to your colleagues, set up those regular catch-ups and seek support when you need it. The RCP also has a range of online mental health and wellbeing resources which you may find useful and are in the links below. Stay safe, and I hope that in some ways remote technologies may allow us to come closer, even while social distancing in these extraordinary times. To summarise, I've talked a bit about what digital healthcare is and the types of it, when it may be appropriate and some of the key differences, which I hope has given you an insight into how you can apply it. It's likely to be new and different for a lot of clinicians, and whilst it has its limitations, I hope you agree that especially in the context of COVID-19, it also has huge potential. When you're getting started, talk to your colleagues, use the guidance and test the tech out. Even if it doesn't go as smoothly as you hope, having a backup plan and your key contacts and resources to hand is all you need to solve most problems. Please keep checking back to the RCP COVID-19 page where you see a range of resources being continually developed to help and support clinicians at this time. Before I go, I'd like to leave you some recent feedback from one of our patients at Zava. With all the confusion and fear over corona, my doctor's surgery has closed its doors. It's interesting that the perception of the online world is that it's cold and uncaring, when I feel you've proved the opposite is true. Take care.